This program is proudly sponsored by Datec Limited.
Good night, Papua New Guinea. I'm Malcolm Waira, and welcome to another episode of Infocus. In this session of Infocus, we discuss the prevalence of kidney diseases in Papua New Guinea. We are joined by the PNG Kidney Foundation's dialysis manager, Mr. Basil Patrick, and Dr. Albert Anthony, physician at the Port Moresby General Hospital and the PNG Kidney Foundation. Gentlemen, thank you for joining us.
Thank you, Malcolm. Pleasure to be here.
Firstly, Dr. Anthony, could you give us a context on the current prevalence of kidney diseases in Papua New Guinea?
At the moment, Papua New Guinea, we don't have what we call kidney registry where we can pick up the numbers and give. So we don't have exact data to give in terms of the prevalence. But the trend is that we have been seeing increasing number of kidney diseases, both in terms of acute, like ones where we can treat and then they recover, and then chronic kidney diseases that stays with the patient long time and then eventually kills them. So at the moment, we don't have the exact number to give, but the trend is that it is increasing.
What would you attribute such a trend to?
The increase in the prevalence now that we are seeing is that it's in relation to the number of diabetes trend that is increasing, as well as the high blood pressure that we are seeing in the general population. So if you go to any of the provincial hospitals in Papua New Guinea, you will see that the number one cause of people or patients attending to consultation clinics on daily basis is hypertension or high blood pressure and then diabetes. And because it is an increasing trend, it's also leading to, or one of the complications that ensues or results from high blood pressure and diabetes is kidney failure, apart from heart failure, and then people ending up with having stroke.
To what extent does lifestyle practice contribute to such instances?
Yes, in earlier literatures, medical literatures for Papua New Guinea from like in the 1950s, 60s, coming to 70s, we have seen the literature that when they reported on disease statistics, the number of kidney diseases were really low. But as we approach the 90s, coming up to 2000s and up to the 2020s, we are seeing really increasing number of diabetes and hypertension. And then as a result, the increasing number of kidney failure as well as heart diseases too. So it's more related to the lifestyles. Initially, our forefathers, they live a simple lifestyle, not exposed to the modern way of life that we are living. So the modern way of life, exposure to processed food and stressful working environment and all those are leading to all those contributing factors that we are seeing and then resulting in the kidney failures and heart failures that are on the increasing trend in Papua New Guinea.
Okay. Recently, a colleague of yours from your organization, he mentioned that another cause of kidney diseases is the overuse of painkillers to treat pain. Could you clarify that?
Thank you, and that's very important because at the moment at PNG Kidney Foundation, we have about 2 patients who have ended up with kidney failure requiring long-term dialysis because of use of painkillers on chronic basis. So there are some medications that are contraindicated in those ones who have high blood pressure or diabetes, because when somebody has got high blood pressure and diabetes and get those painkillers, they concurrently with the high blood pressure itself or the diabetes itself, plus that medication combined together and can damage the kidney. So some of the medicines that are used to treat conditions like gouty arthritis or some other chronic arthritis like diclofenac, Voltaren, Indoseed. In the short term, they can be good in terms of treating the pain, but in the long term, and especially with chronic use, they end up with a kidney damage, and somebody can end up with end-stage kidney failure where they can end up requiring dialysis for lifelong.
Could you tell us a bit about the PNG Kidney Foundation and the services it offers?
Thank you, Malcolm. PNG Kidney Foundation was established in 2012, and the current location at Kennedy Estate, 8 Mile, was started in 2014. So it's a NGO-run organization, non-government-run organization, where it comes in to fill the gap where there was no way out for those people who were suffering from kidney failure, end-stage kidney failure for that matter. So once somebody is diagnosed with end-stage kidney failure, they either have a long-term dialysis or they either have a kidney transplant. So PNG Kidney Foundation was established to come in to at least help the patients to have the dialysis while awaiting for them to go overseas for their kidney transplant.
So the procedures they're quite expensive to run in Papua New Guinea?
Yes, the cost of running dialysis service on daily basis is quite expensive because there's a lot of consumables or equipment that is used to dialyze one patient. So for example, to dialyze one patient, the machine will have to put in a artificial kidney. So because their kidney is totally not working or partially, for those ones who are doing their dialysis, it has to be more than 70% non-functioning kidney. And because it's more than 70% non-functioning, they tend to accumulate a lot of waste that the body normally removes. So that's why the work of the kidney is to remove those toxins or the waste that the normal kidney was supposed to remove. So they need an artificial kidney and then all the blood tubings and then some specialized medications that we infuse during the process of dialysis to prevent any blood clots along the tubes or in the patient's blood. So we make the dialysis process more smooth and safer for the patients. So a lot of consumables, so a lot of cost involved in providing dialysis to one patient.
Basil, could you, in a nutshell, explain the process of the kidney dialysis procedure?
Okay, thank you, Malcolm. In dialysis procedure, before the patient come for dialysis, so the patient must have the vascular access that where the blood will come through to the machine and the blood will filter with a dialyzer, or we can call the artificial kidney. So the vascular access will by done the neurosurgeon, the minor surgical. So the vascular access we can use 4 to 6 weeks before the process of the hemodialysis. So the doctor will do the vascular access and wait for the vascular mature, and before they wait for the vascular mature, the doctor will done the catheter for the process for the patient to do the dialysis. So during the dialysis, the blood will filter use the artificial kidney, and the dialysis procedure take times 3 to 4 hours. Some patients cannot tolerate to until 4 hours because during dialysis there are so many complications during the dialysis.
Thank you, Basil. We'll go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching Infocus. Now, Dr. Anthony, are there lifestyle changes that you recommend which can help prevent kidney diseases?
Yes, like I mentioned earlier on, most of the kidney failure patients that we are seeing now is more to do with lifestyle related changes. So the risk factors, the common risk factors for kidney failure, like I mentioned, high blood pressure and diabetes. So high blood pressure is brought more about because of the changes in the diet that we are having in terms of more of processed food, more of salty food, and the stressful lifestyle that we encounter because of the work, stress from work, family stress, and all those. And as well as we are aging too, blood pressure is something that also increases with aging. So that's something that we cannot change, but especially in terms of our stress level, in terms of our diet, in reduction of salty food, sugary stuff, and then high amount of fatty food. So those are the contributing factors that end up with result in high blood pressure. So if we can minimize those, and one of the other factors is that because of the amount of time that we spend at work and the level of stress that we encounter, we tend to minimize the number of hours that we spend into ourselves to like go out and then do some exercises, walk around, at least sweat, so that in that way we release some stress, at least burn up some excess fats or sugar, so that at least we allow our body to settle down, and then the heart to pump, and then the blood vessels to at least be smooth, so blood can flow smoothly without having to raise the blood pressure. So just exercise alone tends to help to reduce the blood pressure, reduce the stress level. So that's one of the things that we need to encourage. And then the type of food that we are eating, and then how we manage our stress at work and at home. So once we do those, we reduce the blood pressure. We can also reduce the blood sugar, especially in terms of our sugar intake from soft drinks that are really rich in sugar, and then take away food that's oily, cooked with oils and they are fatty. So once we take those, then we increase the risk of developing high blood pressure, high blood sugar, and then this can also lead to chronic pains. So chronic pains like gouty arthritis, or even what we call osteoarthritis, which will eventually lead us to depending on painkillers. And then like on the other, with the other question that I mentioned, once we depend on painkillers now, we can also damage our kidney too.
Now, Basil, the PNG Kidney Foundation recently signed a memorandum of understanding with the Port Moresby General Hospital. What does this partnership entail?
Okay, thank you. Regarding that one, the memorandum of understanding between the PNG-KF and Port Moresby General Hospital intercollaboration aim at improving kidney health service and patient care. Through this agreement, the PNG Kidney Foundation will take the leading role in managing dialysis service at POMGEN. So, providing necessary support to enhance the hospital capability in delivering vital treatment. Our shared mission is not just about addressing the current, but about building a sustainable model that will serve the people of Papua New Guinea into the future.
Dr. Anthony, what's your take on this particular MOA?
Yeah, the MOA stands to at least come in the space where sometimes with especially public-run programs, sometimes there's that interruption because of lack of funding and all those. So once we have the partnership with PNG Kidney Foundation, the Kidney Foundation just continue to run the service with the manpower and with the equipment and with the daily consumables. So in that way, the dialysis is not interrupted because it's managed and run by the NGO, which is the PNG Kidney Foundation. So Port Moresby General Hospital, whenever they come in to support in terms of funding, they can, they provide the funding whenever their fundings are available. So the important thing is that the dialysis service continues and patients are not compromised.
How many kidney dialysis centers do we have around the country so far?
Okay, in Papua New Guinea at the moment, we have so far in operation about 4, 3 in Port Moresby and 1 outside of Port Moresby. So in Port Moresby, we have a PNG Kidney Foundation, we have a Pacific International Hospital, and then we have a Port Moresby General Hospital. And outside of Port Moresby, we have a Mendi General Hospital, supported by Kumul Petroleum Holdings Limited, that are running the dialysis service up in Mendi, and as well as saving bulk of the other highlands provinces as well. So they are doing good up there.
Thank you, Dr. Anthony. We'll now go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching In Focus. Now, Dr. Anthony, I understand last year the Port Moresby General Hospital is embarked on plans to start commencing kidney transplant operations. Could you update us on that?
Thank you. Kidney transplant operation is an ambitious plan that we have come up with at Port Moresby General Hospital, and it comes about with the good support of the National Fisheries Authority. They put in the seed funding for us to at least kickstart the program. So at the moment, the discussion is ongoing, and we have had a specialist team that will be assisting with the transplant coming all the way from the United Kingdom, UK. So they have paid us 2 visits so far. One 2023, and then the other one just late last year, December. So based on the latest visit, the tentative time for kidney transplant to happen is in May 2025. So we look forward to that. There are certain targets that they have left with the Port Moresby General Hospital team to get the in-house issues or operations in order before they come. So that's something that the team at Port Moresby General Hospital is working on to at least get everything in place. So when May comes, we could have the first kidney transplant in Papua New Guinea, and I think that would be the first organ transplant in Papua New Guinea for that matter.
In terms of the capacity of our local medical practitioners, are they able to conduct such operations?
At the moment, we don't have any experience, but we have had several of our doctors, especially the surgeons, who have gone abroad and have some hands-on training on short-term basis to at least have some feel of transplant surgery. So we have the leading surgeon who will be assisting the UK team when they come over, Dr. Damien Hasola. He has had several exposures in UK as well as in Taiwan, where he is well-versed with processes that are involved in doing transplants. So when the UK team come, they will at least also help train him and then train our local staff, the nurses, as well as some other cadres of health workers that will be fully involved in the dialysis, not dialysis, but the kidney transplant process.
Okay. Now, Basila, how can the greater public at large assist and help the PNG Kidney Foundation?
Okay, thank you. As we all know, the PNG Kidney Foundation is a non-profit organization dedicated to helping people with kidney disease. So the greater public can assist the PNG Kidney Foundation in a several impactful ways, like awareness campaign. During the awareness campaign, engaging in and promoting awareness campaign about kidney health, organ donation, and the foundation initiative can help educate the community. So the community also like a fundraising event, do the fundraising event, organizing or participating in fundraising events such as charity runs, action, or community gathering. So that can raise essential funds for the foundation activities. And also the community also like do a volunteer. Offering time and skill of volunteer can provide direct support to the foundation program and initiatives. The could range from administrative help to organize the event.
PNG Kidney Foundation very much dependent on good, kind-hearted donors as well as business houses that come on board and then support us. So, apart from providing the dialysis, we also provide free transport for pickup and drop-off using a bus that was donated by BSP, and we are thankful of that. So it's something that we are pretty much mindful of the costs that are involved in at least sustaining the dialysis for long term. So if you go to other facilities, the cost is really high. So PNG Kidney Foundation, as much as possible, try to get the cost down to minimum as much as possible, so make it affordable to, for our ordinary Papua New Guineans to afford. So much of our funds come from donations and from fundraisings that we do. So if we put out notices, if viewers can also be involved in at least supporting us to raise funds for very much needed service.
Dr. Anthony, do you have any final remarks you'd like to make for the public at large?
Thank you, Malcolm. And I think it's something that I wanted to mention, but I didn't mention. We've talked about the prevention aspect of it in terms of managing those risks. But one of the important things that I would want to at least make known to the viewers of Papua New Guinea is that kidney disease, it doesn't have any specific signs and symptoms in the earlier stage. And by the time the signs and symptoms appear, it's already late. in the later stages. So it's very, very important that we have to have a wellness health checks. So it's important for each and every one to at least be mindful of their own health. So you can go to your nearest health facility, any of the private facility or wherever that they are doing a general health checkup. So at least you get to know the status of your kidney, your heart, your blood sugar and blood pressure, because those are the things that are what we call, they are silent killers. So without knowing, and then eventually you end up with complications. And by the time the complications happen, it's already too late. So important message, takeaway is for us, each and every Papua New Guinean to at least at some point in time in a year, just go to have your blood checked or blood pressure checked so that you know your status. Or if you have high blood pressure or blood sugar, you must make sure you have your kidneys checked to make sure that you don't have any kidney issues, because there are medicines available that can help prevent going into end-stage kidney failure, where you will end up having requiring dialysis or kidney transplant. So that's part of as an awareness message. Get your health checked. Thank you.
Basil Patrick and Dr. Albert Anthony, thank you for joining us.
Thank you, Malcolm. Thank you for having us.
Well, viewers, that ends this episode of In Focus. Do join us again next week, Monday, on our regular time slot of 7 p.m. Till then, bye for now.
This program was proudly sponsored by Daytech Limited.